C4 and Brian Neiman. Heard weekdays from 5:30 to 10 a.m. on WBAL News Radio 1090 and FM 101.5. Now, the C4 and Brian Neiman podcast on WBAL.com and the WBAL app.
It is hard to believe, Brian Neiman, a year ago, Maryland Governor Larry Hogan declared a state of emergency, and we began to enter this pandemic COVID-19 reality that forced us to look at everything that we do from a medical lens. We were very fortunate a month into it in April to partner with Greater Baltimore Medical Center Healthcare, GBMC Healthcare, to begin a series of town hall meetings that we are really privileged and appreciate being a part of. And now we look to reopening as we now have the vaccines about, Brian, as we have all this thing. How do we move forward is the real question. We're going to be joined by Dr. Theodore Bailey, Chief of the Division of Infectious Diseases. And then later on in this half hour, we're going to be joined by Dr. John Chissar, the President and CEO of GBMC Healthcare. After the 9:30 news, Dr. Teresa Nguyen, pediatrician. And then later on, Neri Cohen, Dr. Neri Cohen, who is the IT information liaison about the whole thing of telehealth. But let's begin with Dr. Theodore Bailey. Good morning, Dr. Bailey.
Hey, Dr. Bailey.
Appreciate you joining us again. Now that we are into this a year now, Dr. Bailey, and we've had so many Marylanders either, be infected or now they're getting their vaccine, what are you seeing in terms of long-term effects of COVID-19 for those that have had this?
Well, we see a phenomenon called long haulers, which is in a distinct minority of patients. But what it seems to involve is, for the most part, some dysfunction, either respiratory dysfunction, stamina seems to be less. There's also a condition we call POTS, where the nervous system that kind of controls our blood pressure allows us to be active. It seems not to be quite back to what it was before infection. The basis for these long-lasting symptoms is not known yet, and our priority has been research on, enabling survival and preventing the infection. So I think it's not been an area that's been as well researched as it will need to be. We don't quite have the answers and the cures yet for these symptoms.
As someone who suffers from POTS, I can attest to that. Lots of water, lots of salt. That's why I eat all that extra salt, C4, as you well know,
hear you.
having had a few steaks with me over the years. All right, so, Doctor, we have a vaccine, and we have 3 of them that are out there right now. Would you say that they're working? I mean, how would you describe how it's going so far with not the rollout of how many people can get it, but just the effectiveness of the vaccine?
Well, that's difficult to measure at this point because it's layered. You should think about the vaccine again as perhaps as an airbag alongside seatbelts, alongside safe driving, alongside not texting. This is a thing that adds on to our ways of reducing risk. We're still seeing COVID infections. We're still seeing hospitalizations and deaths. We have less than we had in December and January, but we're ticking up a little bit. So the impact of the vaccine is always going to be difficult to discern from everything else that we do. So really right now we just know we need to get more of it out there. Sitting on the shelf, it doesn't offer any protection. In the arm, it can.
You're listening to Dr. Theodore Bailey. He's our first guest of many doctors who will be joining us today on our series of town hall specials, the coronavirus, our partnership with GBMC Healthcare. Dr. Bailey, when it comes to, I take my mom for a second shot tomorrow, okay? And as people are getting their second shots, how do we navigate around each other? What are some of the things we can do once we're vaccinated?
Well, I think that's the right thing. So, there's really, with vaccines out there are really 3 kinds of scenarios, 3 kinds of social scenarios. There's vaccinated people interacting with vaccinated people, unvaccinated people interacting with unvaccinated people, and then vaccinated people interacting with unvaccinated people. If you're talking about vaccinated people interacting with vaccinated people, I would say that that's the kind of scenario that is as safe as other kinds of established infections where we wouldn't think about just sort of putting it off or deferring it. So, I think getting together a vaccinated family member with another vaccinated family member, is I think something that can happen now. Would I still wear masks? Yes, I would. And one of the reasons is that even in the vaccinated groups, we would still see some low level of infection, but this is really now something much more like flu or other respiratory infections, not something that's pandemic severe. If you're talking about unvaccinated to unvaccinated, for those people, it's like nothing has happened. This is like they're back in 2020. They're as at risk of severe infection and of picking it up and transmitting it to each other as they ever were. So there's nothing really should change for those 2 individuals. And then if you're talking about vaccinated to unvaccinated, you're still talking about someone in that mix who's vulnerable. And I think I'd probably treat them as I would in that last scenario where it's unvaxxed to unvaxxed. I would really say that the area where we can really relax things is between vaccinated individuals.
But when can we definitively know how effective they are? I mean, you look at the studies out of Israel, and the numbers are extremely low now over there. It doesn't seem like there's much transmission at all from those who have been vaccinated. When will we definitively be able to tell through these studies that these vaccines, either they are protecting us, or B, I think maybe most importantly, stopping the ability of spread?
I think we already know that. I think the studies were extremely well conducted, and they were conducted with very large numbers of individuals over a many months period of time. And so we really saw dramatic reductions in whether you even get ill at all, and even more incredible is that it would really take away the threat of death if you were infected. But again, that can only happen, in the vaccinated individuals. It's not some sort of, we're not at a herd immunity level, so we don't yet, that benefit doesn't yet confer to unvaccinated individuals. And at this point in Maryland, we've vaccinated about a third of individuals, and that's equivalent to basically if you were trying to prevent forest fires, hosing down 1 out of every 3 trees, and then believing that the other trees just can't burn anymore, which would be false there, and it's false with COVID as well.
Dr. Theodore Bailey, how important is it to have between Pfizer and Moderna the 2-shot regimen, and then Johnson & Johnson the 1-shot regimen, just so people, they should get any shot, they should, but how important is it to have those options?
Well, one of the things that those options afford is it allows multiple parallel manufacturing, so that you're able to produce those vaccines in parallel with each other and really provide large supply, large quantity to a population that still needs to be vaccinated. So I think that the real benefit of getting several options out there is to be able to get large amounts of vaccine out on a steady basis and make it available to the vaccine centers and available to the population.
Well, can I go back to that one last point you were making? That is, let's just say that I've been fully vaccinated. If I've been fully vaccinated and these studies are accurate and it's most possible for me to get, or I'm not going to get sick from it, or it's going to be very difficult and most impossible for me to spread it, then why can't I go about living my life that I normally would pre-COVID?
Well, I think you can, and that's why I teased out that group. I think one reason, though, to limit it in terms of your access to the non-vaccinated individuals, right, is we did see infections in the vaccinated group. And, among that group, we would still expect them, if you're the person who's picked it up, and you're that 5%, say, who is vaccinated but gets infected, you're not going to have a severe illness. We know that. But you would have the infection, and we do see household clusters, right? So sort of, liaising with unvaccinated individuals without masks and such puts you at risk of picking it up from them because they're unprotected, and gives you a chance to sort of bring it back to, areas where we're usually not on guard, which would be at home. So that would be my reservation there. I think vaccinated to vaccinated, I think we can have social interactions that are as safe as anything ever had been with other kinds of infections.
Well, so you would say that if you've been vaccinated, that you can go and travel, you wouldn't have a problem with that?
I would not have a problem with that.
Chief of the Division of Infectious Diseases at GBMC Healthcare, Dr. Theodore Bailey. When it comes to these variants, we keep hearing the UK variant and Brazilian variant, all these variants. How significant is this, particularly as we're getting vaccinated, Dr. Bailey?
Well, there's two things. There's the variants that we've seen, and then there's the more general fact that we have observed the emergence of variants, which speaks to the idea that this virus can mutate and can develop new forms of itself. So the current variants, we have them, so we can test them against the vaccinated populations. We seem to be seeing, for instance, good protection against the Brazil variant, which is more transmissible, maybe more deadly, but also seems to be covered by the vaccines. But once we understand the concept of variants, we may see new variants. And so it's something that we have to remain vigilant about, maintain good public health surveillance, and as they emerge, make sure that they're tested and we understand whether our vaccines are not protective against them. I would say this, though. We've developed the concept of COVID vaccine, not just the vaccines we have, but we've been able to prove that we can vaccinate against COVID. And so if we do see variants that we need new vaccines for, we shouldn't have the same kind of wait to develop the new versions, I don't think. We would be looking at this more as a booster phenomena, or maybe more appropriate would be the way we vaccinate against influenza each season because of new variants.
Is there anything that you take away from this in the last year and say, wow, this is really going to help us down the road? New science, new way of looking at things, whether it is with COVID, another viral infection, the flu, or anything else? What's the optimism that you see?
Well, I think the optimism is seeing in our modern medicine the possibility of a pandemic. And so that if we see viruses that have the transmission ability and the deadliness to them, but they're still on a very small scale, that we really should work together. There should be sharing of information, and we really should be getting on board with developing vaccines against it sooner rather than later, not waiting to find out whether it becomes a pandemic, just recognizing it could be, knowing that pandemics can be real, and really working together across national boundaries to get that thing controlled early rather than later.
Great. Dr. Bailey, always a pleasure.
So much.
Thank you so much for your time.